The digestive system has been through many different milestones since humans' fruition. Not only can the digestive system stomach these milestones, they can totally eliminate them. When you think of homeostasis, the digestive system will always listen to its gut instincts.
The functions of the digestive system is digestion, absorption, and elimination. Digestion is the breakdown of food into subparticles and the absorption of them. Absorption is when the intestines allow molecules to permeate into the bloodstream. Elimination is the removal of waste out of the body.
Keeping the digestive system healthy is pretty easy. All you have to do is take probiotics to balance bacteria within the large intestine and allow things to digest smoothly. A fibrous and low-fat diet allows food to be eliminated very efficiently. Eating slowly and remaining upright during consumption can prevent heartburn. Regular exercise and fluid intake allows food to pass through the system more efficiently as well. Starting at the age of 50, it is good to get regular colonoscopies, especially with a history of colon cancer. And always make sure to talk to your doctor if you have any digestion problems.
A person could also contract a disease from ill-prepared food.
When a person eats a malnutritious diet, their digestive system suffers from the inability to absorb the required glucose for cellular respiration.
The actor portrayal you have just seen demonstrates common symptoms for constipation. These symptoms include slow bowel movement, hard or small stools, few bowel movements, a swollen belly, or a feeling that not everything was evacuated. Some causes for constipation include a poor diet, problems eliminating the stool, or poor bowel habits. Treatments include laxatives, a change in diet, prescription medications, and in worst case scenarios, surgery. Around 4.4 million people in the US have constipation today. This is every 1 in 61 people.
20% of people with Crohn's disease have a close relative who suffer from the same signs and symptoms. This supports the theory that Crohn's disease is a genetic disease. The signs and symptoms are rectal bleeding, chronic diarrhea, abdominal pain, and weight loss. Bowel resection and medications are the best treatment for this disease.
This is horrible.
The actor portrayal you have just seen shows common symptoms of appendicitis. Appendicitis is the inflammation of the appendix due to viral or bacterial infection. Appendicitis affects 25% of the population and mostly affects 18-year-olds and under. The biggest danger of appendicitis is the danger of rupture. When the appendix ruptures, you will then get your body to become septic. When this happens, the bacteria will spread throughout your body. There is a simple procedure in order to remove your appendix. So this procedure is just the removal of the appendix. Thank you.
Because Wilson's disease is a genetic mutation of the 13th chromosome, there is no known cure for this disease. Copper buildup is one of the main issues associated with Wilson's disease, so treatment is a lifelong process aimed at reducing the excess copper in your body. Osteoarthritis, difficulty speaking, liver cirrhosis or liver scarring, and personality changes, among many others, are some symptoms of Wilson's disease. Wilson's disease has a prevalence of 1 in 30,000 individuals.
actor portrayal, you can see symptoms of diverticulitis, which include abdominal pain, nausea, vomiting, and perhaps rectal bleeding. Diverticulosis consists of pouches of air that develop in the large intestine. Diverticulitis is when these become inflamed. Both of these illnesses can be diagnosed through a colonoscopy. They are caused by a low-fiber diet and possibly genetic factors. Some symptoms are different for both diseases. Diverticulosis is more common, but it is usually asymptomatic. Diverticulitis is when the diverticula, or the pouches, become inflamed and can be very severe. Approximately 50% of Americans above the age of 60 get diverticulosis. It can be treated by eating a high-fiber diet, and for diverticulitis, a liquid diet, antibiotics, and possibly surgery. An interesting fact is that in Asia, people tend to have the diverticula on the right side, while in the West they tend to have it on the left side.
Stomatitis is a bacterial infection that affects the mouth. There are many different ways to contract it. So, there are numerous treatments for the infection. The causes of stomatitis are nutritional deficiencies, food sensitivities, inflammatory bowel disease, and a weak immune system. Symptoms include blisters over the gums, plate, and cheek. The treatments for stomatitis are antibacterial drugs, coating agents to relieve the pain, and trichomocline to reduce the swelling. The statistics of this disease are as follows. The prevalence of stomatitis was estimated to be about 21.7%, with most cases occurring in third world countries.
The overarching important idea to remember is that the digestive system requires a fine balance between many different aspects. Like any other system, it's bound to malfunction when encountered by a disease, but it is vital to your health that the digestive system stay in working condition as it provides the nutrients required for homeostasis.